Hi, I'm Christina Cusimanio, Senior Vice President of Marketing at AGS Health, and today I have the privilege of sitting here with Conrad Coopersmith, our General Manager of Technology and our Coding Solutions. And today we're going to talk about coding automation and get real life experience and real life information. So with that, thank you, Conrad, for joining us today.
Thanks for having me, Christina. Looking forward to the dialogue.
So Conrad, while you're here today, can you paint a picture for our audience of the current landscape of medical coding automation? What are some of the most common forms we're seeing today, ranging from basic assistance to more advanced solutions?
Well, first of all, coding automation is not a new thing. It's been around since, I would say, the early aughts. It went from more of a rote approach to automation, meaning more of an RPA-based type of approach to computer-assisted coding, which really didn't catch on until 2010, 2015. Nowadays, what we're seeing much more AI infused with coding, and we're even seeing by certain specialties autonomous technologies which are being sent direct to bill without a human in the loop. So a variety of different interaction models which include both technology and people.
So, Conrad, are there any common misconceptions about medical coding automation that you frequently encounter, and what's the reality behind them?
We do, and I do, as you would expect. Like any technology, there are chasms. And I would say there's a lot of noise in the industry right now. And what I mean by that is we are using the word autonomous. And what that means to me and to us is if you send me 100 charts, regardless of the specialty, I'm going to send 95 of those charts direct to bill with a human never seeing or touching them. And they're going to be paid based on the fact that the codes are right. The reality is, and what's actually happening, is there are very few specialties that can be completely automated. And there's reasons for that, which includes the complexity of the medicine itself. Where we are seeing gains are in high outpatient settings. Think about things like the emergency department and radiology. So it's not that the computing won't get there. In fact, it's going to accelerate drastically in the next 2 to 4 years. But we believe there will always be a human in the loop based on the complexity of the work.
So while we're talking about autonomous coding and technology, what are some of the key performance indicators or KPIs that healthcare organizations should track to measure the effectiveness and the ROI or the return on investment of their medical coding automation initiatives?
3 things. And whether it's autonomous or manual, the reality is they're the same things. They are turnaround time, which is typically measured by 24 or 48 hours by the time you get the chart to code it. They are reimbursement. Are you getting all the earned reimbursement you should based on the fact that the code is correct and everything's accounted for? And quality. Is it at or above 95%? They are the same things, whether a human's doing it or a machine is doing it. And again, based on the complexity of the medical service, many times it's going to require both.
So how crucial is the role of data quality and human oversight in the successful implementation and evolution of medical coding automation, especially as AI becomes more sophisticated? What are your thoughts on that?
I would say it's paramount. And it could be coding automation or any type of automation in a healthcare setting, whether it's a provider group or it's a hospital or a health system. And then what I mean by that, when you think about the process for coding automation, there's a lot of different inputs. There is inputs from the electronic health record. There are inputs from physician progress notes. There are diagnostic inputs from laboratory, radiology, pharmacy, etc. What we do is we take all that information, we organize it, we associate it using artificial intelligence, and ultimately we prospectively suggest codes in order to adjudicate a chart and ultimately get the provider reimbursed for the services that they rendered. So with all that said, what I would say is data in, data out. And there are great dependencies on how providers receive the data. And if the data is dirty, it naturally is not going to lead to a great result. The other thing I would add on to what I just said was going back to the thesis that there will always be a human in the loop. We believe we at AGS are in a unique position to take advantage of this paradigm because we want staff to be focused on what we would call the hard work. So we want to automate what's simpler and easier, have staff focus on what is harder, and we want to distribute the work between the two.
Last question for you, Conrad. What advice would you give to healthcare leaders who are considering implementing or scaling their medical coding automation efforts to ensure a smooth and successful transition? What advice do you have?
3 things. Do your diligence up front. What I mean by that is do your own discovery on your own processes. Any type of automation, if done incorrectly, could make a bad process worse faster. So understand where the inputs and outputs are, map it, and then plan on a future state. Do the same thing on the clinical side. We talked about the fact that the data is paramount. If you can't feed the machine, ultimately the results are probably going to be less than optimal. And the last thing I would say is start small. Pick a specialty, automate the specialty, study the specialty, and then wash, rinse, and repeat. What's important from our perspective is our clients have one platform to use. One platform for inpatient coding automation, one platform for professional coding automation, one platform for CDI, one platform that brings together analytics, because it's all interconnected at the same level, as are the insights. And even though we're measuring different things depending on the care setting, they all roll up to the same place, which are the quality departments and the office of the CFO.
Fascinating topic, Conrad. Thank you for talking to us about coding automation and AI and automating the healthcare system. Thank you very much. We really appreciate it.
Great to be here.